Hello everyone and welcome to Ovarian Cancer Australia's Information and Support webinar. My name is Vanessa Elford. I'm part of the support team at Ovarian Cancer Australia. I'd like to begin by acknowledging the traditional owners of the land that we're on and pay my respects to elders past and present. I'd also like to acknowledge and thank Telematics for providing us with the funding to deliver this project. The focus of this webinar will be on exercise and cancer. We have two incredible presenters who are going to share some valuable information with you. The webinar is interactive, so over the next hour you can ask questions to the presenters who are going to share, you can ask questions to the presenters by typing into the chat box at the bottom left-hand corner of your screen. Questions will be answered at the end of each speaker's presentation. Please note that presenters cannot address individual medical cases. If you have a particular question, please call the Ovarian Cancer Australia Information and Support line on 1300 660 334. This webinar is being recorded live and will be posted on the Ovarian Cancer Australia website. If you're having trouble with the sound, you can dial the 1800 number listed in the chat box. So I'm now extremely privileged to introduce our presenters to you. Our first presenter is Associate Professor Prue Cormie. Associate Professor Cormie is an accredited exercise physiologist whose research and clinical work focuses on the role of exercise in the management of cancer. Her track record includes over $9 million in competitive research grant funding and over 70 reference publications. Prue is the inaugural chair of the Clinical Oncology Society of Australia Exercise Cancer Group and the lead author on the COSA position statement on exercise in cancer care. Associate Professor Cormie aims to enhance the lives of people with cancer through innovative research and effectively transferring research into practice. Our second presenter is Julie Coos. Julie is a 62-year-old lady who was diagnosed with stage 3 primary peritoneal cancer in April 2015 at the age of 59. I'd like to highlight that Ovarian Cancer Australia supports women with fallopian tube, primary peritoneal cancer and ovarian cancer. These names may be used interchangeably by medical specialists and the treatment is the same. Julie has recently undergone radiation therapy to treat a recurrence. Exercise has been extremely important to her since being diagnosed. Since participating in regular physical activity, she says she has never felt stronger and is very grateful to feel so well 3.5 years after her diagnosis. So I'd like to now hand it over to Associate Professor Prue Cormie.
Thank you very much, Vanessa. It's my great pleasure to be able to be involved with this webinar and have an opportunity to talk to you today about the use of exercise as medicine for ovarian cancer. So why should we exercise? Well, based on what the science tells us, exercise is one of the best medicines you can take in addition to your standard cancer therapies. And that's because we know that exercise can help minimize the functional impairments associated with cancer treatment, is the best medicine to counteract cancer-related fatigue. It helps to relieve mental distress and the stress associated with the diagnosis and treatment of cancer. And what we know from a considerable body of research is that exercise actually helps to improve people's quality of life. And that's over not just physical domains, but also about mental well-being and social well-being. Now we know from this body of research that exercise, when it's appropriately prescribed and appropriately delivered, is safe for people with cancer, both during their treatments and also after your treatments as well. Now what we can also see from the science is that exercise may actually help you tolerate the treatments that you're going through. We know that people who are undergoing chemotherapy and are exercising can actually tolerate greater dosages of that chemotherapy. And there's some very early evidence from the research literature that suggests that exercise may be doing something in terms of preventing the cancer from spreading throughout the body as aggressively as it may do. Now, if you look at all of these effects, it's absolutely undoubtable that if the effects of exercise could be encapsulated into a pill, it would be demanded by every single cancer patient, it would be prescribed by every single cancer doctor and nurse, and it would be subsidised by government. Now, the sad fact is that we can't just take exercise, you have to do exercise. So that makes it a little bit more difficult. But when we actually look at the evidence base around the effects of exercise, we know that it's probably the most effective medicine you can take in addition to your cancer therapy. Now, what do I actually mean by thinking about exercise as a medicine? We all know that exercise is good for us, right? And it's good for everybody, irrespective if you have ovarian cancer or not. What do I mean by exercise medicine? Well, as an exercise physiologist and a scientist, I've spent a lot of time investigating what happens inside our bodies when we exercise. And exercise specialists can use this knowledge of understanding what happens to our body systems when we exercise, prescribe exercise in the same way that any doctor prescribes any kind of medication. So we're talking about a very specific type of exercise at a precise intensity, which is how hard that exercise is, and also at a volume, which is how much that exercise you have to do. And that's based on the changes that we need to see within our body to realise some sort of health benefit. And that health benefit can vary depending on what outcome you're after. Now, if we would love to think that we can encapsulate the effects of exercise into a pill, but that will never happen. And that's unfortunate, but the reason why that will never happen is because exercise positively influences the structure and the function of virtually all of our body systems at the same time. And there's really no other therapy or medication that can positively influence as many body systems as exercise can. Now, in the same way that you wouldn't be taking an antihistamine to treat your ovarian cancer, we can use very specific types of exercise to realise very specific types of health benefits. In this way, we can prescribe certain exercise. We can tailor that exercise to the outcomes that we may want, whether that's preventing fatigue or helping maintain muscle mass or a favourable body composition. And we can also individualise that exercise in the same way that certain types of medicines can be individualised for people. So while we know that any activity is good for us and any exercise you can do is very good, if we take the view that exercise is a medicine, we can maximise the potential health benefits there will be to counteract the negative effects of cancer and its treatment. Now, if we can do that, we really see that exercise should be prescribed as a standard component of cancer care. And this is really what we're calling for with all the cancer doctors and nurses and other health professionals involved with the care of anybody who has cancer. And that is to think about exercise as an important medicine that goes alongside the surgery, the chemotherapy, potential radiotherapy or immunotherapies that you may be going through. And to actually prescribe exercise specifically to help counteract the negative side effects of the treatments that you'll be going through. Now, of course, I'm going to say this because I love exercise. I'm an exercise tragic. I spend a lot of time actually researching exercise. But it's not just my view. This is the view of the peak professional body in Australia that represents all the health professionals involved with the care of people with cancer, so doctors, nurses, psychologists, and therapists and pharmacists and so on. And it's the position of this full organisation to say that exercise should be viewed as a standard component of cancer care. And it really calls on all the doctors involved with your care to actually discuss exercise as part of that treatment plan and to specifically counteract the side effects of the treatment. To actually prescribe exercise as part of the treatment plan, to say that all of these treatments were very effective at helping to slow the growth of your cancer, but they can cause other negative side effects. We can prescribe exercise to help minimise the impact of those negative side effects on your life. And the COSA position statement and the organisation also calls for best practice care to include referral to an exercise specialist who's got experience working with people with cancer, and they're accredited exercise physiologists or physiotherapists. So this is really the why of what we should, or why we should be exercising and why we should be incorporating exercise into a standard component of cancer care. But if we were to actually do this, if we were to prescribe exercise to each of you guys as part of your ovarian cancer treatment, what exactly is that prescription and how do you fill it? Well, we work off what's called evidence-based guidelines, and this is a summary of all the scientific literature to date, all the research that's done to figure out exactly what we should be recommending you guys to do to realise the most benefit from exercise in terms of preventing the negative side effects of cancer and its treatment. And these guidelines, first of all, saying with as much as possible, if you can avoid inactivity, that's going to be very beneficial to help in the management of your ovarian cancer. So what does that mean, avoid inactivity? It's really meaning just being as physically active as you can be, given the fact that you're going through some very difficult treatments and that may cause a lot of health issues and functional things that you may not be able to do that you used to do. So just trying to be as physically active as your current condition and your ability allows. And that may be, at one stage, it might be just getting up off the couch and going for a walk to the mailbox. And for another person, that may be, at their stage of treatment, that may be going for a 30-minute brisk walk around the neighbourhood, and that varies depending on who you are, but as much as possible to avoid inactivity. Now, these guidelines also say that if you want to maximise what we call the therapeutic effect of exercise, and that means what's the health benefit of exercise to your body and your overall well-being, then it's attempting to work towards, and if you can achieve it, try and maintain participation in regular aerobic and resistance exercise. Now, these numbers here are the levels or the targets that come out of this scientific literature. And they may seem extremely out of reach for a lot of people. So remember that this is just a target that you can be progressing towards steadily. But what do these numbers mean? So 150 minutes of a moderate intensity aerobic exercise means a brisk 30-minute walk on 5 days a week. Now, moderate intensity is very key here. Now, intensity is basically how hard that exercise is or how difficult it is. Now, this means that a moderate intensity is something that you'll have to be walking like you're late for a very important appointment. So instead of walking along with a chihuahua, think about being pulled along by a German shepherd. So your heart will have to be beating, you'll be puffing, you won't be, unless you're Beyonce and you can sing and dance at the same time, you won't be able to maintain a normal conversation. It'll be a bit disjointed. And you will feel a little bit tired afterwards. Now, that's what we talk about for aerobic exercise. So it's things like walking, riding a bike or cycling in a gym, swimming and so on. Now, in addition to this, and what's so often overlooked when we're talking about adhering with exercise guidelines is what we call resistance exercise. Now, that's lifting weights. It doesn't necessarily have to be in a gym. It can be at home, it can be in the park, it can be all sorts of places. But typically speaking, that's lifting weights using the major muscle groups in your body. Now, the recommendations suggest that a target of 2 to 3 exercise sessions each week with the lifting weights at a moderate intensity involving about 6 to 8 exercises. So that works out to around a 30 to 45 minute session on 2 to 3 days a week. And again, it's moderate intensity. So you need to be working quite hard so that you'll be sweating, you'll be puffing a little bit, and your heart rate will be, your heart will be beating a little bit more than it usually would. Now, as I said before, for a lot of you guys and a lot of the people that we work with, these targets are completely unattainable and really not appropriate for some people depending on where they are in their treatment phase. So the key caveat to these guidelines is they need to be individually tailored and progressed so that this actual framework of what you're trying to achieve is relevant to you, to where you are right now, and making sure that you can actually then progress towards what's attainable for you. So how do we individually tailor and progress this? What kind of considerations do we have? Well, I want to make sure that when I see you as a patient, the most important thing to me in individualising this is what's important to you, and make sure that we can use exercise in a way to achieve the goals that you want to achieve, whether that's being able to play with your children or your grandchildren or get back to work or whatever it may be. Now, after that, I go through and I consider a whole range of things that become really important in terms of making that medicine right for you. We talk about what kind of cancer you have in terms of the stage and your prognosis, what treatments you've had previously, what treatments you're going through now, and what treatments you may be having soon or coming up, and whether or not you're experiencing any symptoms and side effects to those treatments, how severe those symptoms are, and is there anything that triggers those symptoms? We also think about your functional ability. How, do you have any movements that you can't do or restrictions to your surgery or anything like that? We look at your overall health status as well. Are there other chronic diseases or issues or back pain or so on, or pelvic floor issues if you've had children? Are these things that we need to consider when making sure that that exercise prescription is right for you? In addition to this, when we individually tailor this medicine, we've also to be thinking about practical considerations. So, how often you can exercise, when you can exercise, can you incorporate it in with your daily routine, and how we can actually do that. So that's just a very short snapshot of some of the things that we think about when we're individually tailoring this exercise. So you can imagine, there's a lot of complexity there, and if you don't have any idea about what to do with exercise, or you've never exercised before, it can be very daunting to actually start this and understand what's safe for you and what's the most appropriate thing to do for you. So in terms of being able to individually prescribe this, you really need to see the right health professional. And who is this? Who's the person that should be prescribing the exercise so that it's individualized to you? That health professional is what we call an accredited exercise physiologist. Now, accredited exercise physiologist, or an exercise physiologist, or EP for short, they've actually gone through university, so 4 or 5 years. They're registered as an allied health professional, and all of their learning and their professional development has been focused on understanding how to use exercise as a medicine to help patients who have chronic diseases. Now, in Australia, there's over 5,000 exercise physiologists practicing throughout the country, and most of these are in community-based organisations, so not necessarily in the hospital, but out in your local area. Sometimes it's hard to find or know who these people are, and there's a website where you can actually go to, which is called Exercise and Sports Science Australia, which is the accrediting body. You can click on that link there, and you can pop in your postcode and find somebody close to you. Now, unfortunately, not everybody has experience in cancer, and not everyone will have experience with working with people who have ovarian cancer. So if you're interested in finding out who's the right person to talk to, or understanding how they can try and upskill or get a little bit more information about that, just reach out to Ovarian Cancer Australia and we can provide you with some information there. So if you go through this whole process, say, yes, I'm going to exercise, I'm going to see the right person, how much is this actually going to cost you? Well, the good news is that there's benefits available through Medicare and a subsidised plan that you can actually use to access the services of exercise physiologists. Now, that's through the Enhanced Primary Care Plan, and that's actually you have to go to your GP to ask for an Enhanced Primary Care Plan to see an exercise physiologist. So if your GP can do that and refer you on to an exercise physiologist, you'll be able to have a reduction in the cost of that individual consult, so it may cost something around $10 for you. In addition to this, if you have private health insurance, there's over 30 private health insurers now that subsidise the cost of actually going to see an exercise physiologist, and the level of subsidy changes all the time depending on who you're with and what level of coverage you have. But if you have a conversation with an exercise physiologist, they'll be able to give you all the information you need about accessing those discounts. Now, while we do think about this as an extra cost, and I understand how cost is a big issue, and we certainly see that there's a lot of extra costs associated with going through cancer, I'd just challenge you to reframe this thought of exercise being an additional cost as actually being an investment, and an investment that comes with additional health benefits, not just to your physical and mental well-being, your actual cancer, helping to manage your cancer, but it's also about then managing other chronic diseases or issues you may have had previously. I certainly consider my exercise as my health insurance policy, and I would venture a guess that exercise is probably the most effective health insurance policy you can invest in. So if you do all this and you say, yes, I still want to go, I'm going to pay, I'm going to get the subsidy, would you actually be able to do exercise and enough exercise to generate a physical benefit? I think a lot of people are scared about doing exercise and not sure whether they can and whether they're capable of exercising enough to get a benefit. But what we can see is people who have never exercised before or aren't exercising a lot when they come to see us, they actually can and do adhere to exercise. So they can come up and actually work through a program that involves 2 to 3 days a week of clinic-based exercise programs, and they turn up 80 to 90% of the time. And only about 10% of people can drop out over those 6 months. So even though it seems very scary at the start, and a lot of people will be scared at the start, you can do this, and a lot of people have confirmed that that's the case. Another question that may happen is, you know, like, I feel so unwell, can I actually do this, first of all? And if I do it, will I respond to it? Will this medicine be beneficial to me? Well, what we actually see from the research that we've been doing involving hundreds of people with cancer is that it's actually the people who have the worst symptoms, or so they're experiencing the highest level of fatigue or the worst functional impairments or the highest level of psychological stress, they actually benefit the most from getting involved in an exercise program. So even though you may feel that you may not be able to exercise, you're the exact person that will actually benefit the most from getting involved in exercise. So what is the best way to do this? What's the most effective approach? From the research evidence, it really starts by being supervised by the right person, and that's an accredited exercise physiologist. If you can do your exercise somewhere that is close to your home or your work or your childcare or your school arrangement, and that is really important so you can maintain this as a normal lifestyle behaviour. And if you get the option to actually be engaged with a group of people who have cancer, not necessarily ovarian cancer, we've seen from a lot of research this can be very beneficial in terms of helping you continue to exercise and then also benefit from the interactions that you have with everyone within the group. Now, can this actually be done? And I think this is a really important question. We don't want to just refer to the science and think about this in a theoretical point of view, but can we operationalise this? Well, the answer to this question is yes, we can, and we are doing that. And that's through a program called XMed Cancer, which really takes everything we know from the scientific literature and our clinical practice and puts it into the one package. But it's not just telling you to exercise, but it's actually providing the support and the resources and the structure that you need to learn how to exercise, what to do, how do you actually do this long term by yourself. And you can actually then realise very significant health benefits during this program. Supervised by the right kind of person, an upskilled exercise physiologist, and it runs throughout a range of different sites here in Melbourne, and we're expanding it throughout Australia in the next year or so. And I suppose I could talk all day about exercise, but I think what I'd like to do is try and give you a bit of a flavour of some of the benefits that exercise can have with people with cancer. And we have one of our patients involved with this video that I'll show on the next slide who has ovarian cancer.
I think the diagnosis of cancer was devastating.
I was shocked beyond words.
And all of a sudden my comfort area of knowing what was going to happen was gone.
To come out of a gruelling experience of chemotherapy, radiotherapy, to a world that you're not quite sure how to fit into anymore. Sorry.
Based on what the science tells us, exercise is the best medicine someone with cancer can take in addition to their standard treatments. And that's because exercise lowers the relative risk of cancer coming back, lowers the risk of dying of cancer, and it helps people tolerate their treatments so they experience fewer and less severe side effects.
I went from being a patient to living again.
I could get up in the morning now. I'm bounced out of bed in the morning now.
Getting up was a major exercise. I can now do it inside probably 10 seconds.
Mentally, it's really helped me to be more myself.
It's ridiculous, but I feel I could go and do a lot of things that I wouldn't have done in the past.
And I'm getting stronger all the time.
This project is really leading the fight to get exercise embedded in the standard component of cancer care internationally. And the data that's generated out of this project will really allow for us to change the way that we fight cancer.
The best part about it is, I think, that the time between now and whatever happens in the future, it'll be a better quality of life.
It's the missing link between cancer treatment and living a well life.
So you have just a little snapshot of some people's experience of XMed cancer. And again, if anybody's interested in this, please feel free to reach out to us or reach out to us through Ovarian Cancer Australia. Oh, sorry about that. So I think if we summarise this, I've just told you a whole bunch of ways that you may be able to engage in exercise and what we know from the science around what's the best way to do this. But really, what's the most important thing to do for you and what's the best approach for you? It really comes down to what works for you. And I would encourage you to explore this with the appropriate allied health professional. And if you're concerned about your exercise or you're not sure what to do or you just want to try and figure out what works for you, is really about going and seeking the advice of a professional. An accredited exercise physiologist that can help you figure out all these questions and make sure that the exercise prescription is right for you. So thanks very much. Very happy to take any questions you may have. And I'll just throw to Vanessa.
Thank you very much, Associate Professor Cormie, for that extremely interesting and valuable presentation. We just have a couple of questions. One is about XMed. What should I do to find out more information and register for XMed?
You can reach out to us through the website, which is www.exmedcancer.org.au. You can actually, there's a whole bunch of information there, but you can also click on the Enroll Now button and pop in your name and phone number, and we'll give you a call and talk about everything that's involved with the program. And I should say as well, if you're not, if you look at the website and you realise, look, it's not a site or a location that's convenient for me, you feel free to give us a call, and what we can do is provide a range of different resources and also a referral to an exercise physiologist who's close to your home. So we'll do the best I can to help you exercise.
Great, and one more question. Do I need permission from my treating specialist before I begin participating in exercise?
That is a really excellent question. So the answer is really no. You don't need to get a referral from your oncology team. You can actually go out and seek out the services of an exercise physiologist. Now, if you have any concern whatsoever around the safety of that exercise or what you should be doing, if you flag that with your exercise physiologist or if you flag it with your oncology or cancer team, then we can actually communicate together, and those the exercise physiologists can talk to your nurses and your doctors around your treatments and any concerns you may have. So you can actually self-refer yourself into an exercise program, whether it's XMed Cancer or seeing another exercise physiologist. You can also talk to your GP around if you don't know who to see and you're going to see your GP, you can ask them if they know any exercise physiologists in your local area. But you don't need permission from your doctors to actually start exercising.
Great, thank you very much. Thanks again, Associate Professor Cormie, for joining us on this webinar. We really appreciate your time. Just a reminder to all the viewers on the webinar, if you have any questions for our speakers, you can type them in the bottom left-hand chat box on your screen.